Albury questions.
Name and title for us.
Sure. So Emma Field, COVID-19 Coordinator at the Murrumbidgee Local Health District.
Perfect. All good.
Yep,
Lovely.
good
So
day.
we've got some updates today on a bunch of things, I imagine. Where do you want to start? The case number?
Yeah, I'll start with the case numbers. So today that we're announcing that we've had another further 30 new cases for the Murrumbidgee Local Health District. Of that, we had 24 in the Albury LGA. Three of those were in three of the 30 were in Murray River, 2 in Greater Hume, and 1 in the Murrumbidgee LGA for today.
And in terms of the sewage detections, I know that there was some in Leeton as
Correct.
well, in Griffith.
Yeah. So we've had sewage detections both in Wagga, which is understandably predictable based on having cases, and also in Griffith. And we know we've had someone in the Griffith area as well in the previous week, so that could be attributed to that. However, we have had a new sewage detection in Leeton overnight. So that is of concern. So we're encouraging anyone in the Leeton area to come forward for testing. So the message is monitor for symptoms and get tested. So if you do develop any respiratory symptoms, just to come forward.
Do you have any idea if that's from someone passing through or community transmission?
Well, we know we don't have cases, but so it could be a number of reasons that's turned positive, and obviously, you know, Leeton is on a fairly busy part of the wave in the Murrumbidgee, so it could be an essential worker, could be someone, you know, travelling through, as you said, or it could be an undetected case, and we have to really, I suppose, be mindful that you know, we need to test if at all anyone does have symptoms. So really important, and it's a funny time of the year where people have hay fever, where they're experiencing respiratory symptoms. We're just reminding community, please please remain vigilant to those symptoms and come forward for testing.
I was just having to chat about the booster shots as
Sure.
well. So I guess first off, who will be able to access them?
Yeah, so what we know, first of all, we'll talk about the third primary dose for immunocompromised people. Now, I just wanted to confirm that we are now seeing people coming through, flowing into our clinics for third primary dose Pfizer doses. That's what we're offering. So we would encourage anyone in the community who is immunocompromised, come in and see us. It's a very easy process. It's a declaration form. Come in and talk to our staff here. It's a walk-in process. You don't need to register, and come in and get that third dose. That won't affect your vaccination status, as we've heard in the media over the last week. 2 doses of the vaccine is still sufficient for you to be compliant. However, booster shots, they have now been announced for. We're looking at commencement in that early first week in November is what we're hearing. We don't have a start date, but as soon as we're ready to go, we've got all our systems, you know, ready to take on the booster shots. We do know that it will go in a chronological type of response. So for 6 months will be the gap between your last dose and your next dose. So we'll be methodically going through that with our current VAM, which is our vaccine management system, and we'll be able to offer those vaccines to people who were 6 months. And we know some of our 1As, for example, our healthcare workers, in particular in our emergency services, they have had their second shot over 3 months ago. So we'd be very obviously working towards getting them in first and foremost.
And will it be available for everyone in the long run, or is it just going to be for people with a poor immune system?
So first we can do the immunocompromised are eligible right now. So walk in right now. So anyone that is in our communities, we're encouraging you to come forward and to get that third primary dose. You are eligible, and we want to see you in our clinics getting that third primary dose. But with booster shots, we're just waiting for that, go ahead from the state for that start date. And as soon as we have that, we'll be ready to go. All the Murrumbidgee Local Health District clinics are ready to go in terms of the back end. We've got everything ready there for our booster shots, and we will be offering Pfizer for our booster shot.
And just to clarify, will the MLHD essentially be sending like a bit of a notification to people to book in that booster shot, or do you advise that people just take note of when they got their second shot and mark the date for 6 months later in their diary to then get in touch and book it in.
Yeah, so that part of it, which is a really important part, we're waiting for that for the state to give us further advice on that. We hope that there will be a type of messaging system that will help with that. Given that we had a really good electronic system managing the vaccine process, I would see that as a feature that we could use, is to send those messages out and push those out.
In the MLHD update this morning, there was a call out for residents of the Edward River to come forward for vaccinations. Are you concerned about the Edward River, and are there any other pockets that you guys are worried aren't taking up the vaccine fast enough?
Look, I think probably one thing to say about vaccine rates and LGA vaccine rates is that the way it's measured, and you've probably seen this on the website on how they give you the LGA rates. One of the disclaimers is to just be very mindful of rurality, and rurality in itself brings some some weakness to that data when they pull it out of the system. So we have found with the Edward River, we're seeing really good uptake with vaccination. The community has also been very vocal that they've got really good uptake. So I think we just need to be very mindful of the limitations of what that data has for us in that regard, and it's important to look and drill down into that LGA's towns and work with them, and which is what the Murrumbidgee Local Health District and the Primary Health Network have been doing, is working with them on how can we offer vaccination in all different parts of that LGA. And I can tell you next week we're off to, just to make sure we have got it covered, we're off to Blighty, Canargo, all those little spaces around there, Wanganella. So we're taking our Vax van out to those little areas just to make sure that if there is anyone left in that LGA that has not had the opportunity to be vaccinated, for them to come forward so that they don't have to drive anywhere. So I just say, in summary, we just need to caution with data as it's pulled out of those systems. There's a little bit more to it. So we're working with the community and the council to make sure that we can get their percentages as accurate as possible.
Now, just turning to the Service New South Wales app, so obviously there's been a shift in the system. So for anyone who is a close contact, they will be contacted directly by New South Wales Health. But when we're talking about exposure sites and venues of concern, people are going to start getting push notifications through the Service New South Wales app. However, not everyone in our community uses the app. Some people don't have phones, they're not tech savvy, etc. Are you concerned that those people aren't going to have access to the information because it's not being posted anywhere else?
I think there's some comms there, and I'm glad you've asked that question, because I think there is some comms to do around those people that don't have, as you said, rightly said, don't have access to a phone, and that system is exactly what you just said it is. So when you are going into a venue and it then comes up as an area of exposure, you will be getting that push notification, and we know that there's a group of people that don't have access to that. What we have got, and what we've learnt from Service New South Wales, is that people who don't have a phone have access to a QR code, and that QR code they can use when they go into venues, and they scan that. So at the back end, when we've got that shop may become an exposure site, then they're able to contact the public health unit and give that person's name. So a personal phone call is made to that person to say you were actually in this place at that time. So there's a little bit of work to do, I think, in commsing that out to the community. So I'm sure Service New South Wales will be coming forward with a bit of that soon.
But just to clarify, that's only if they're a close contact. No, that's not if they're just been to a venue of exposure.
Yeah, look, that's correct. You are right. So if it's a close contact. So I think there's a little bit of work to do in that space around if it's just a casual contact and an exposure and a monitor for symptoms, which is what that Service New South Wales app will push out. It's a monitor for symptoms. Yeah. So this is something that we're very keen to hear what they're going to do in that space, particularly for our aged community members, to ensure that they've also got that same information. Yeah.
I'm just looking to the border now as well. So there's a sort of expectation that people will come forward for testing on day 13 of their isolation, as I understand. A lot of people went into isolation around the same time. Is the MLHD putting in anything into place to sort of help with that testing demand?
Yeah, definitely. So as of last week, we put a number of testing clinics in the Albury side of the border. So at the moment, we're currently at the Albury Entertainment Centre, and we're there and we've been testing and vaxing. So very quite a unique model. We've seen it in other parts of the state as they've had outbreaks, and we're providing that same response there. So people can go there and they can be tested, but they can also, if they haven't had a vaccination, and we know that Albury's vaccination rates are very high, up around that 95% and above for first dose completions. However, we are offering that testing there. Now we're going to be moving around the Albury area because we want to make sure we get to as many pockets of Albury where people are requiring testing. So I think it's really important to note in Albury, for our Albury community, there are a number of options for people. There is the Wodonga side, and they've got 3 clinics there, 2 drive-ins and 1 walk-in. On the Albury side, we've got the entertainment centre that's currently in there till 4 o'clock, and then we've also got our partners. So the Albury Showgrounds, there's a drive-through there. There's also another drive-through at the Lavington Sports Ground, and we also have another walk-in clinic at the Lavington Hall. So there's a number of options. We also have a very unique response in Albury, given the high numbers. There's options for in-home testing. For people who cannot get out of their home, we acknowledge that that's a very difficult space. So we do have a team responding directly to that as well. We also know the private pathology providers down there are working really hard to make sure those people get tested. So it's really important that we have a number of options available. So we'll be there right through until the end of next week, where we just reassess, and we'll certainly stay for as long as we're needed in the Albury community.
Do we have any updates on the Wagga cases in terms of where they came from and are they transferred?
Yeah, no, not at this point. We don't have any further advice on those particular cases. Obviously, some we've been able to move to the connected to an existing case. So we had those, which I think we reported last time. But in terms of our current one, no, we haven't got any further advice on that one just yet.
Sure.
Yeah.
I just heard as well, this could be complete rumour, but
Yep.
the Ormond solicitors has shut down because of
Oh.
COVID concern.
Okay.
I'm not too sure if you know.
I don't know about that one. Yes.
No worries.
And look, we do have a number of venues, and I think, certainly now we've moved to the venue tracker, it's making it a lot easier for people to get that immediacy. I know many, probably like yourselves, many of colleagues are receiving those notices and, acting upon those. It's just really important, I think, to get out into the community that message of that the Service New South Wales app pushing out those notifications. It is a monitor for symptoms. Community should be really confident that our public health unit will be in contact with you if you are a close contact, and will give you very specific advice around what you need to do. So don't be worried that you're going to miss something on an app. I can assure you close contacts will be all followed up individually. Yep.
And just one more question. In terms of the booster shot, I just want to double check the immunocompromised. Did they have to wait 6 months as well, or is it just
No.
whenever?
No, they can come straight back in. No, it's a great question. Yeah, so immunocompromised can come straight in and they can talk with us, and they don't have to wait 6 months since their last shot. So we're very keen to get that group of the community in. So we're appealing to the community to come forward if they are in that group and they do have conditions that put them into that category of immunocompromised. We're very keen to see you. So come forward.
Can we go back to Edward River, please?
Yeah, sure.
So what's MLHD's current understanding of the Edward River vaccination rate, please?
Yeah, so the current vaccination rate that we have from the Commonwealth data that was released on Monday, now I'm going to give you the exact data. The one that we've just received is that it's a 67.4% first dose and 58.9%. That's the one that you've got as well. Yeah, that's the one I've got. So we're spending a lot of time looking into this because, as we've talked about last time, and a lot of people are talking about this, the rates can vary. And if you actually go and look onto that postcode, it gives you a 95% first dose, which is fascinating, and it doesn't really align. So we're very interested in, and we've been working with the ministry, and I know the ministry is working very hard on some of these anomalies to try and make sure that it's actually reflecting what is happening on the ground. So I would just say that when you do go and look in there, you will see that there is that disclaimer. And a lot of it has to do with postcodes and how they're actually linked on the ground to those that LGA. So we know there's been some issues with linkages. So I would just say, yes, we're aware of it. and we're working on it with that LGA. We're doing everything we can to make sure that it's as accurate as possible. But in saying that, we're working in parallel as well in terms of providing them every opportunity, just in case there is some, level of unvaccinated that we're not seeing. But the community is a very proactive community. Can I just say, Edward River, all of those, the council, all of those GP clinics that are vaccinating, the pharmacies, everyone there is, they're doing a great job in, getting out to their community members and saying, hey, come in and get vaccinated if you're not. And two, we understand there's a data issue, can you help us? So we're very interested and very keen always to work with them, and we are, yeah.
Jill Ludford said on ABC Riverina this morning that
Yep.
there was an issue with some of that mapping of the
Yeah.
data. Is that the issue?
Yes, it is. There is some issues with the mapping of the data. It's really about that postcode. So, one of the best analogies I can give you is this, the way I understand it, is that, in our footprint here in Murrumbidgee, in our towns, we know them quite intimately. And if we see a no-through road, for example, on a map, we know that we've driven down there, we know we can get through it. So when we're looking at data on a map base, and this is the way it's extracted, they see just what is given to them on a map. But we know in our LGAs that, there are certain, things like that. We know that we can get through that road, so the map's not accurate. Same rule applies here. It's probably the best way I can describe it, is that we've got some intricacies there on the ground in the LGA. Lots of big farming families as well that may have, for example, they may have PO boxes, and then PO boxes don't get mapped in the right way. So there's lots of little things there that we're trying to work really hard in alerting the Commonwealth to, and the Ministry to, just to say, hey, we know that there's some issues with the data reporting. We also know that on the ground, because the Edward River LGA community members, they're very proactive, and they really do want to get to the bottom of this. They've been doing some amazing work by adding up their vaccines and adding up their population and saying, hey, this doesn't add up. So we're very keen to get this right. So yeah, I would encourage people to go onto that site and click on the postcode and have a look at the postcode for Denny, rather than having a look at the whole LGA. And you'll see, if you look around at the postcodes, really high rates, above 95% for first dose.
So that's being done to correct the data?
Yeah.
Getting people to look on and seeing what actually is happening?
Yeah, so we're working really hard. We have been for a couple of weeks now. So, it's been a really great response. All of those very, very smart people, the data analysts in the state, they're looking at this. And we have seen some other examples across the state of this as well, from what I'm hearing anecdotally. So we're very keen to have this rectified.
So are you concerned about vaccination rates through that part of the world?
I'm not as concerned as I was, certainly with the information that I have now. So what we're hearing, absolutely, that there are good rates of vaccination, and we just need to find the way to make that representative of what's actually happening on the ground. We go out there a lot for vaccination, and as I said, we're trying to sort of now look at not leaving any stone unturned. So going out to those little places like Conago, Blighty, Wanganella, taking, the van out that way. We may get small numbers, but that's okay. We just want to make sure everyone's had an opportunity. Yeah.
Are you concerned about the relaxing restrictions next week? And is the community considered vulnerable?
Look, like everything, as soon as we change something or do something different, I would say that we are just on alert. So we're ready for that, in that we have the same tools available to us in terms of testing, vaccination. I just remind the community, this is the time now to be extra vigilant. So when you are going into shops and areas, please remember to QR code. I know that it's getting a little bit laborious, and I know that that can be complicating for some people, and, just encouraging everyone in the community, whilst we are opening up, this is the time now to do a number of things. 1, check in when you are going into a shop. 2, get vaccinated if you're not. 3, don't relax on these respiratory symptoms. As I said, perfect time of the year, hay fever. Please come forward and get tested. There are lots of options available for testing. And we're just really encouraging those three things. They're the three really, if you're abiding by those three things, you'll do, that's the safest you can possibly be.
Aubrey sent me 2 questions.
Yep.
Rapid antigen
Yeah.
testing will be available next week. Can you outline if any of these will be used by local health authorities?
Yeah, so we don't use rapid antigen testing for a clinical decision-making tool in terms of what we use is a PCR, which you're very familiar with, and that happens in every one of our testing sites. We will not be substituting rapid antigen testing at all into our clinics at all. So that's it, bottom line. Yep.
And the second one is, would you encourage people to use the rapid test to ease pressure on local sites?
I believe rapid antigen testing does have its place in this current climate. Certainly where you're seeing high numbers, we've seen overseas, if you look at the research behind it, where you've got those high numbers, it serves its purpose. It's got a surveillance purpose, and I think that's really important to note. So we've seen many of our big business in the area, they utilise rapid antigen testing now. There's a really good process that backs up rapid antigen testing, and that if you do receive what they call a non-negative or a positive, that you then have to alert the public health unit, and that you then go and have a PCR. So yes, it does have its place. That's my short answer to that. That's for a surveillance for surveillance purposes, and it allows really big volume testing when you need it. So where you've got big pockets, and we've seen it happen in schools, we've seen it happen, as I said, in big business where you've got hundreds coming on each day, and you need to have a sense of confidence that people are coming on negative. So certainly it definitely has its purpose. So, and we will always work to what is being utilised in the current environment, and use that within our armour of tools. Yep.
Anything else? Thanks, Emma.
No worries.
Next week's
Yep.
numbers.
If I just get a photo of